I'm Randy Neiswonger. Welcome to this edition of Community B. Today I have Dr. Liang. Dr. Liang, thanks for joining me.
Of course, great to be here.
Can you tell our audience what you do here at Community Hospital?
Of course. Yeah, my name is Dr. Liang. I'm one of the ER physicians that works here on a day-to-day basis taking care of patients. I'm also the medical director that helps oversee some of the operations in our department and trying to improve the care that we deliver to patients.
Excellent, and great care that you guys do, and I'm always very grateful for you and your team's contribution to our friends, family, and neighbors. You know, since the pandemic, we've seen an increasing need to use emergency services for a variety of different reasons. Recently, we've seen the need to use it for RSV, flu. Additionally, we've seen some consolidation of healthcare services here in our local geography. Can you talk a little bit about, how people can understand or patients can understand the appropriate level of care needed for their disease process or ailments?
So, the emergency room exists to primarily treat and diagnose emergency conditions. These are things such as heart attacks, strokes, infections that require surgery. And within the community, we have all the resources needed to treat from beginning to end those conditions, such as heart attacks, we're a chest pain center. With strokes, we're a comprehensive stroke center as well. Now, in many cases, patients don't know what's going on, which is why they come to the emergency room, and we are here to help diagnose and rule out any potential issues and treat those other issues. For cases that are urgent but less serious, within community we have a number of urgent cares as well, which specializes in treating conditions such as sprains, potential fractures, cuts that might require sutures, simple or mild cough and cold symptoms that might require testing for COVID or influenza. And so those are available in numerous cities in the nearby area. Yeah. So anytime there's a potential for a life-threatening disease, that is something you should always go to the emergency room for, whether that's chest pain with a concern for a heart attack, numbness and tingling that you're not sure is a stroke, any potential illness where you think you might require surgery. Anytime a patient is not sure whether or not they could have a life-threatening issue, they should come to the ER. For things that are urgent but do not appear life-threatening, urgent cares are appropriate to go to first, and the doctors there are equipped to decide whether or not they need to escalate the level of care. Anytime a patient might have questions about chronic issues that they have, such as their diabetes medication, blood pressure issues, in many of these cases, a primary care physician is best suited to address those needs. And we have a number of primary care physicians available within community to help take care of that.
Yeah, thank you. And I know some folks that may be listening to this don't have access to a primary care. Give our call center a call, and we're happy to facilitate that introduction. Thank you so much for your time today. Really appreciate everything you do and your contributions. And we'll see you guys next time on Community B.